Did you know that neurosurgeons now have the capability to dye brain tumors hot pink? This allows us to visualize the tumor better than ever before, which makes for better outcomes. Yesterday, I presented the case of a 70-year-old female who came to my office complaining of balance troubles for about a month. She's had rapid deterioration of her short term memory, so her primary care doctor ordered an MRI of her brain that showed this. MRI of the brain with contrast, we see this rim enhancing lesion in the right frontal lobe with a lot of surrounding vasogenic edema. On the coronal views, we see this large golf ball sized mass. If we look at this side of the brain compared to this side of the brain, you can tell that that part of the brain is very swollen. Here we see the normal gyri and the black stuff, which is a spinal fluid. And here on this side of the brain, we don't see any of that. And that's because it's swollen. That's because that tumor is rapidly growing and putting pressure on the brain. That pressure is what's causing the balance troubles as well as the rapidly progressive short-term memory loss. Also, I mentioned that the patient's hand function has gotten worse recently as well. That's because this part of the brain right here controls hand function on that side. It's getting compressed, so her hand is getting weaker. Okay, doctor, but what is it? It's a highly malignant brain tumor called a glioblastoma. It's a type of cancer that starts in the brain and it grows rapidly with symptoms starting within just a few weeks. It invades and destroys the normal brain. Therefore, the symptoms that it causes really depends on what part of the brain it starts in. The most common symptoms are seizures, headaches, memory loss, as well as nausea and vomiting. That's related to the swelling of the brain surrounding the tumor. The most common age group is people in their 60s to 70s, and it's more common in men. In most cases of glioblastoma, we don't know the cause. The treatment is usually surgery plus chemo and radiation, and that only controls the tumor because there is no known cure. Meaning, with maximum treatment, the tumor almost always comes back. The prognosis in most cases is less than 18 months. So the treatment is really to remove as much of the tumor as possible and to give treatments to slow its growth and rate of recurrence. The problem with resecting these tumors as a neurosurgeon is that they're extremely challenging to define the borders. It looks just like the normal brain, and they grow little fingers to infiltrate the brain. Kind of like that. The bottom line is the best resection we can give the patient means the longest chance of survival for them. So much cool technology exists now to allow us to get the best resection possible. Intraoperative navigation allows us to identify the region where the tumor is without doubt. We can stimulate the motor cortex during surgery to make sure that we stay out of critical areas. You've probably even seen some awake surgeries on the internet. We can get patients to do things during surgery to make sure we don't remove that part of the brain. There's even advancements to allow us to deliver radiation treatments right to the tumor. What about seeing those little invading arms during surgery? How do we get to that? 3 hours before surgery, we can give the patients a drink that will light up their tumor hot pink. What? This significantly improves the visualization during surgery, and we can remove more of the tumor. Now back to my patient. This is before surgery, and here is his MRI 6 months postoperatively without any signs of recurrence. She completed her radiation treatments after surgery and has been on chemo since that time. She's back to normal and is doing all of her normal activities again. We've given her her best chance to slow recurrence. That's another case of patient-focused and compassionate care. Stay tuned next week and I'll go through another case.